All right, thank you for staying with us. Cervical cancer has been identified as one of the leading causes of deaths worldwide. It is often referred to as the silent killer and almost entirely preventable. It is the fourth most prevalent cancer among women globally. More than 95% of cervical cancer is caused by sexually transmitted HPV, which is the fourth most common type of cancer in women globally, with 90% of these women living in low and middle income countries. Now, the HPV vaccine protects against genital warts and most cases of cervical cancer. It protects against cancer of the vagina, vulva, penis, or anus caused by HPV. The vaccine gives the body a safe way to build immune system awareness of some HPV strains. This means the body has an easier time clearing out those strains of the virus if a person catches them later. Now, some people have expressed fears that getting the vaccine could cause infertility. However, this fear is unfounded, as there is currently no reliable evidence that links current or previous HPV vaccines with fertility-related problems. Well, joining us now from Abuja via Zoom is Dr. Obinna Ibirim, a public health physician and health promotion specialist. Good morning, Dr. Ibirim. Thank you for joining us.
Good morning. It's my pleasure to be here today.
Dr. Ibirim, I'm certain that you have heard this new one that people are talking about, this human papillomavirus vaccine causing fertility problems. So help us dispel it, help us educate people to understand that this is not the case.
All right, thank you very much. So let me start by saying categorically clearly this morning that this is false. And I'm not saying it because I'm a public health physician. I'm saying it because this is not new. So let me start with COVID-19. I know a lot of viewers will recall clearly when we were told that if you take the COVID-19 vaccine, that was over 2 years ago, that by now all of us will drop dead. Yeah, we are. At least you can see me and you can see everyone. So we are not new to that. Now, this is just very recent. So let's say, okay, maybe the time is not here yet, right? What about polio? About so many years ago, 10 years ago, thereabout, when we were in the verge of eradicating, eliminating polio from Nigeria, there are all these rumors about, oh, infertility, that if you get polio vaccine, that, right? Now, those who receive these polio vaccines are now mothers. Good enough, in some parts of this country, people get married and start giving birth early, right? So if those stories were true, by this time, we would have seen maybe a great population decline, right? But right now, our population is increasing, and we're having over 200 million people in Nigeria, and we're even said to be going to be one of the largest population in some years' time. So I just want to inform viewers this morning that there is a group of people which I think it's totally unright, unfair, and if I could use the word evil, that you see something that is good for your neighbor, for your community, and you then come up and spread false information. So let me tell you about vaccines. And this is upon my honor, with all sense of integrity and honesty. Now, vaccines go through a thorough process that starts in the lab, and then after which there's some testing that is done in animals, right? It's only when it has been proven to be safe that even the test now goes to a small group of persons who consent. Now, at that point, that vaccine has not been approved for use in humans. It goes through what we call clinical trials of phase 1, phase 2, and phase 3. It's only when it has passed this and gradually it's being introduced to a larger population, it's only at that point that vaccines are now approved. Now, when it's approved, it doesn't mean that you can use it in Nigeria. Now, these vaccines are now shipped into this country in the appropriate temperature, and NAFDAC will have to test and vet that it is good for use in Nigeria before it is approved by the government for use here in Nigeria. So when you look at this rigorous process, there is little or no room for introducing anything that is harmful to fellow humans or Nigerians. So please, and I want to tell viewers that there is a group. So this is not just something that is happening. There is actually a group that are working against vaccines. They call them anti-vax group. So they put up this wrong misinformation and spread it. So please, I'm here today to tell you that this is wrong. People have received HPV vaccines many years and they are alive, healthy, and moving. Now, these vaccines, why I say that this is totally unfair, is that this is a vaccine that will protect our women from cervical cancer. You read out those statistics. Every year, we have about 12,000 cases, new cases, in addition to the old cases, and about 8,000 people dying of cervical cancer. And you know, cancer is not a respecter of human. You might have all the resources, right? And this is something that protects us. So it's so unfair that people are spreading wrong information that has no basis. Can you point to one person, right, that have received this vaccine and you heard any untold effects? So this is wrong. And just to say that it doesn't only protect against cervical cancer. In addition, there's something that a lot of our young people are suffering silently. It's hidden. It's not like cancer that you see the signs and then the person. What we call genital warts. A lot of relationship has been broken because of warts around the genital area. And this is a vaccine that protects against this. So it's not like only when maybe you have cancer, but even genital warts. So this vaccine is very, very important.
Well, also,
and it is safe.
There are so many other speculations out there, increasing Nigeria's reservation towards taking this HPV vaccine or
HPV. That's human papilloma virus vaccine.
Okay, so there are two V's there, right? So one of these is premature menopause. Could you talk to us about whether there is a connection between the HPV vaccine and the onset of menopause?
No, there is no medical or any evidence suggesting that HPV has been introduced in other countries. Nigeria is not the first country, and there is no record. I think what is important is that when people bring this misinformation, let them provide evidence. And one thing we need to be careful, and I think I'm speaking to viewers today, is that if someone says, I took this vaccine, this happened, it does not mean. So for example, you can take paracetamol today, and because you're already having maybe low, your blood level, your PCV and blood level is low, and you faint, right? You don't say because you took paracetamol, that's why you fainted, right? It's if for example, everybody begins to take paracetamol, and you now see that anyone who takes paracetamol faints, then you now say, okay, paracetamol leads to faint, and then we'll then go to the, we'll now conduct a research, right? So this is wrong. There is no onset or early or late onset of menopause associated with HPV. HPV is a vaccine that when you take it, right, it prevents the HPV vaccine from causing those changes in the cells that lead to cervical cancer. And let me tell you the truth, why it is given to young people is because we want to give that vaccine before onset of sexual activity, because there is a very high probability, and this is what people don't know, that the probability is so high that if you have been sexually exposed, that you have HPV. So we try to catch our young girls, and even subsequently there will be vaccines for boys before they start sexual activity, so that we are catching them at the point where there is zero chance of having that vaccine, because this vaccine protects you before you get the virus. It's not a treatment, it's a protection. So I think it's important. It is wrong. It is wrong. Upon my honor, it is wrong.
So are you saying invariably that there are no side effects to taking this vaccine?
So when you talk about the side effects you have is minor side effects. So when you take a vaccine, that's an injection, there will be pain at that side. There will be redness, right? Now, vaccines, and I like being very honest and factual. Vaccines sometimes come up with side effects because human bodies are different, right? So you can take a vaccine and there'll be some side effects. Now, these side effects are minor. Now, when I talked about the phases of trial, the phase of trial does not stop after approving a vaccine. That's what we call phase 4. So when a vaccine has been introduced in a country, there's also ongoing research studying are their side effects. And what I want to tell you is that once we find out a high side effect profile or something that is detrimental to the health of the population, that vaccine will be withdrawn. It is not, in 2015, the malaria vaccine that is being introduced now, it was supposed to be introduced in 2015. I was at the state meeting in Geneva when the vaccine was brought and was seeking approval. When they ran the profile test, it wasn't okay. And at that moment, the stakeholders at that meeting said, no, we can't go and make sure that the safety profile is within an acceptable range. So there is a thorough process. Once there is a side effect that is detrimental to the health of the population, that vaccine will be withdrawn. And I can tell you that HPV vaccine has been introduced in other countries. The particular those that we are using has been introduced in other countries, and there have been phase 4 trials, and no such side effects around fertility or around menopause has been seen. And if that is seen in any in Nigeria, I can assure you that that would be withdrawn. But so far, this vaccine has been introduced some days ago. People have been receiving these vaccines, and we have not seen those side effects. And I can tell you from a point of certainty, I'm not guessing. If that happens, I would come back to say, hey, we are seeing now a number of cases coming up with this, and I would be the one joining the government to call for its withdrawal. But for so far, nobody has made that complaint, both outside this country and in this country, since it was introduced.
Well, looking at the diffusion of innovation theory, there are some people that they will be, very much early adopters, and the last part of it are the laggards who would say, "Oh, we are not going to take this." Some are the risk takers. I remember that we discussed this, sometime last week, 2 weeks ago, and then we've been talking about these on this program, on and on this station. But I want to ask you, how far-reaching do you think this campaign has gone in sensitizing Nigerians towards taking this HPV vaccine?
So yes, you're right. Let me start by saying yes, that as public health promotion specialists and other, we do not expect that everyone would accept a new drug, a new vaccine, even any innovation. So that is why it's important to keep educating people. And I think that the government have done their best. Partners who are also working are also sensitizing. We see people on various media, and that is why I'm here this morning. Now, more work needs to be done, I must tell you, because the truth is that we're a very large country. We're a very diverse country. As I speak to you, there are so many languages that are spoken in this country. English is one out of how many? Is it up to 100 or thereabout? And there are different tribes, right? There are people who do not have access to television, to social media. So this is also a call to the government, to the NOA, National Orientation Agency, and to also partners. How can we reach those in remote villages with the language they understand through a means? If we have to use community theater, let's use it. If we have to use town criers, let's use it, because we must protect our girls, and no girl should be left behind just because he lives in a remote country, or maybe he comes from a family where their parents are not educated. So we must go granular, and we must use a means that resonates with them and use a language that they can understand. So there is more work that needs to be done.
So maybe you would need to explain to the viewers why they need to take this vaccine in clear terms, because sometimes we are talking above the heads of people and they do not understand the implications of taking the vaccine and not taking it, and what the human papilloma virus is all about.
Okay, so let me break it down. Now, there's a virus called HPV, right? Now, that virus, once you have a sexual activity, there is a very, very high chance that you get that virus. Now, that virus will not cause a lot of changes around the womb, the entrance of the womb of a woman, to a point it now becomes cancerous. Everybody knows the word cancer, right? I know with cancer, it then begins to spread in other body, and before you know, the person is dead. Now, cancer causes a lot of money in treatment. It leads to death. Now, also, this virus, once someone gets infected during a sexual intercourse, and this could be various types of sexual intercourse. So we have you then develop what they call, also people develop what they call wat. So you will see something that looks like flower, coriform raising around the genitals. Sometimes for oral intercourse, even around the mouth or the anus. Right now, this it's something that it's not a good sight, and it causes a lot of problems. So these are the two main effects of this HPV virus. Now, once one comes down with this virus, there are some treatments that can, with this illness, right? There are treatments, right? But what we are saying is that why would you go through the pains of this, either the genital wart or cervical cancer? Why would you allow this to cost you a lot of resources and cost the government a lot of resources in terms of healthcare when there is something that can protect you? So scientists went around and said, okay, how do we prevent people from getting this HPV infection due to that virus? And then there is a vaccine. So a vaccine is like a drug you take. Now, you're not taking it to treat. You're taking it to say, okay, if I take this drug, that means this virus, when it comes, it will not get into me. I'm trying to make it as literal as possible, right? So this is what the HPV vaccine is. So it's a vaccine that we give to people before they get infected. So that's why young girls, and if adults must take it, they'll have to go through the pap smear. So that test is just to say, hey, can we check if this virus is there already or not, right? So once we confirm that this vaccine is not there for those who are adults, and we are giving it to young girls who have not had sexual experience, we are now protecting them. So once they have this, when that virus if they get infected during a sexual intercourse, it will not lead to genital wart, it will not lead to cervical cancer, thereby protecting you from cancer, protecting you from this genital wart, and then ensuring that you don't have to spend money and go through this pain. So this is the reason why I am here, and I'm encouraging, and I call it what to encourage every young girl in your community, in your household. Don't miss this opportunity. And then let me tell you that this vaccine has been here all this while, and those who could afford it were getting the vaccines. But what is different now is that government has made this vaccine free of charge, provided you are within 9 to 12 years in public health facilities. It's a phased introduction, so there is some states in the first phase, and then there are some states in the second phase. So this is a golden opportunity, and I'm pleading. Not that I am here. There is no gain for me than to see that people enjoy good health. I'm pleading, please take advantage of this opportunity and go and get this vaccine. It is now free.
Right.
Otherwise.
Right. Sorry to butt in because of our time. I just want to know, because we've been talking about women, girls. I want to clarify something. Is it gender specific? Because when you talk about sexual activities, it's not only done by the female folk.
So the HPV vaccine can be it's for boys and girls. However, due to this vaccine is not the scarcity globally, the introduction by the government is targeting girls. But HPV vaccine is for girls and it's for boys. The effects, especially genital wart, affects both boys and girls. However, as you know, only a woman has a cervix, that's the entrance to the womb. We men, we do not have. That's why cervical cancer is only for women.
Okay. There are those who might think maybe because it's free coming from government, and because a majority of people do not trust the government, they feel that how can government be giving us something for free, vaccination and all of that. But we recall that COVID-19 vaccine was also free. So just take advantage of this opportunity to vaccinate your child or yourself. Thank you, Dr. Obinna Ibirim, public health physician and health promotion specialist, for your time.
You're welcome.
Thank you.